So for several years, the strategic group of experts at the WHO has been telling us we should talk to vaccine hesitant people if we want to understand this phenomenon. So there's vaccine hesitant people, parents out there, but there's also vaccine hesitant doctors. And the prevalent notion was, the past couple of years in the literature, that vaccine hesitant parents cluster around providers of complementary and alternative medicine. And when we did the literature, we were surprised to see that almost nobody had ever spoken to them to figure out why they might be vaccine hesitant, or to go a step further or a step backwards, are they actually vaccine hesitant?
Because other studies have just completely either ignored CAM, or they tend to mystify them, they tend to portray them as these anti-vaccine adversaries. And with our results, we found out that that's not necessarily the case.
So we've designed a qualitative and quantitative research portfolio. So we sent sociologists, trained medical students, a young medical resident trained in qualitative methods to do in-depth qualitative interviews with these providers. And now we're working on a quantitative phase with 2,100 parents and adolescents going to biomedical, traditional physicians, and also to CAM physicians in Switzerland to measure how prevalent is vaccine hesitancy, what are the associations with the vaccine hesitancy that is verbally expressed with what they actually do. So we were trying to get a hold of all the vaccination booklets to see whether the hesitancy correlates with vaccines that have been delayed or not given at all, or no vaccinations at all.
We start with a qualitative phase, and that involves interviews with doctors, CAM and biomedical, interviews with parents, and then observations of consultations between patients and doctors when they talk about vaccination. The second part of our study is the quantitative phase, and we use the results of our qualitative phase to inform the study design of that. And for that, we are doing interviews via telephone with more than 1,300 parents and more than 700 adolescents to talk about the HPV vaccine.
So we felt, let's study and try to figure out what they're doing right and see if we can apply that to the traditional biomedical patient-doctor relationship when it comes to vaccination communication, vaccination counseling.
We see that the CAM providers spend more time with their patients. And, we ask that your typical consultation time, the biomedical doctor is somewhere around 20 minutes. And the CAM provider is 45 minutes to an hour. So, you can cover a lot more ground in that amount of time.
And so what I think is crucial is that we introduce things like taking your time into biomedical vaccination communication, because so far it's typically been vaccines are safe and effective, let's do them, which obviously is okay, but it may not work for quite a large segment of the population.